I'd like to introduce Jessa, Chabeau, and Raina Rappel. Raina Rappel heads up a team of 15 staff and consultants and various interns with expertise in healthcare, public health research, toxicology, air and water quality, strategic development, and community organizing in conducting a targeted and timely public health response to unconventional shale development. Environmental Health Project focuses their work on gathering data from residents of Southwest Pennsylvania and beyond on probable health impacts from oil and gas development, determining routes of exposure, and providing best practice air and water monitoring tools and guidance, as well as accessible and effective interventions for individuals, households, and communities. Jessa Chabeau is the case manager for the Southwest Pennsylvania Environmental Health Project. She received her master's in social work from the University of Pittsburgh, where she focused on community organization and social administration, while also becoming certified in human services management. While studying in the University of Pittsburgh, Jessa participated in a 9-month field placement at EHP, which led to her officially joining the organization after graduation. In addition to her role as case manager, Jessa convenes the stress team and the outreach team. They're here to talk to us today about the Medical Toolbox. Please welcome Jessa and Raina.
So, everyone can hear me? I'm on mic? Okay, great. So we're going to tag team. Jessa works more closely with a lot of the healthcare providers and the social work community. So a lot of times she goes out in the field and does some of the actual training on the toolkit, which we really want to dive deeply into today. And so what we're going to do is we're going to give a relatively brief presentation and do a lot of Q&A, we hope, because we really want this to be tailored to your needs, to answer your questions, to make it more specific, certainly to Colorado. So here's just our learning objectives. We're trying to obviously inform health professionals about unconventional oil and gas development. On the next slide, I'm going to say a little bit more about why we were formed and how we were formed. But again, what we have, and you want to just hold up the actual toolkit itself. So we've been working on this toolkit or toolbox for 4 or 5 years now. Really rolled it out with some of our early medical education, and we've been refining it ever since. So again, what we're trying to do and what we hope you learn from this presentation is really how to identify the environmental exposures of concern and how to also recognize some of the illnesses that we think are related to these environmental exposures. So here's our team, and Raina Rappel, I'm the director. We founded this, and I was one of the founders of this in really 2011. And our mission is really important, especially given some of the previous speakers' talks, because if you look at this, you see individuals and communities' need for access to, and this is something I always totally emphasize, accurate, timely, and trusted public health information. So trust is the biggest thing that EHP has to offer. Knowing what you know, knowing the amount and the scale of development that you've seen in communities around Colorado, trust is in short supply. And we are working to certainly develop and build and retain or even regain trust with impacted community members, but we're also here to develop that kind of trust, expertise, and working relationship with healthcare providers. So I can testify, and I can give countless stories from over the last 7 years. You know, there are healthcare providers out there who really want to be doing the right thing for their patients, but they don't know what that thing is, or they see the divisiveness in their communities, and they're at a loss. And you, as healthcare providers, need the kind of tangible, easy to use, applicable, relevant kind of materials, and you don't have a lot of time. right? So one of the luxuries I would say that EHP has had over the last 5, 6, 7 years is that we spend a tremendous amount of time with our clients. We don't have health insurance breathing down our necks. We don't, have to see a certain number of patients in a day. So we unpack their stories, and they call us again and again and again and again. But what we want to do is turn that knowledge and that expertise into materials for you, who you do not necessarily have that same amount of time. But all of this, again, within the context of trust. Because as we've seen in Pennsylvania, which is where we primarily work and where we started, trust has been eroded and lost, particularly in the state agencies, certainly at the federal level. There's a laundry list of agencies who failed us. I'm not going to go into those. Oh, I turned it off. There we go. Wrong button. So I just want to point out a couple members of our team. And in the center, of course, you see Jessa, and right behind Jessa, you see one of our founding members, Dave Brown, the toxicologist. And we've built a data team around Dave's expertise. Dave worked for many years with the state of Connecticut. He also worked for agencies for toxic substances and disease registry with the CDC. He's worked on Superfund sites. So Dave brings really specific knowledge of environmental contamination and toxicological, like data analysis, air monitoring, air-related exposures. We're working to increase our knowledge. And with Nathan, who's right behind me, he has some water expertise, and he actually has his master's with a focus on more of the water. But this is our team. And again, some of our team is in Connecticut, built around Dave. And what we're trying to do is we're trying to use, and sadly, we know we're guinea pigs in Washington County, Pennsylvania. Many of us here in this room, obviously you see that in Colorado too, but we're trying to engage with the frontline communities. I live in Washington County, really translate our experiences, translate what we see, what we know, what we're observing from emissions monitoring and the health symptoms. And those two things always happen for us side by side. Jessa's going to talk more about that. But we want to take those two pieces of information, the data analysis of the environmental exposures, along with the health symptoms, and tell people, first and foremost, how to protect themselves. So a lot of what you're going to see today is with that in mind. So why should health professionals be alarmed by the rapid growth of, we use the UOGD, unconventional oil and gas development. And I think it's really important, the development aspect of this. Clearly, there's a disregard of the precautionary principle. I'd like to unpack that a little bit further, but as we're seeing these health effects, so much of what we see, and unfortunately so many of the community members that we work with say, well, can I prove this in court? And I'm sure as healthcare professionals, you think about that too. What are the legal implications of this? Is it going to be proven? Right, well, the precautionary principle says this. There's this ethical imperative to prevent rather than merely treat disease. And what we're dealing with are uncertainties. And you saw that again in some of the previous presenters. There's a lot that we still don't know. There's a lot that's layered upon itself in terms of, is it the water? Is it the air? Is it the water vapor that's being volatilized in your shower? You're breathing that in. Is that it? And that's a lot of what EHP tries to explore. Again, we're very, very kind of exploratory, frontline, trying to just really understand this for the people who are being exposed. So a little bit more. So again, why we should be alarmed. Trust issues come out here. We do see this lack of response, certainly in Pennsylvania, and I know you see this in Colorado too. But this is all across the country, right? So anywhere that this is happening, Texas, of course, Colorado, Utah is bad. Ohio is pretty horrific. West Virginia is awful. You know, there's not that meaningful agency response, and you've seen that in again, the previous presentations. So there's that lack of response. What do? Nature abhors a vacuum. That's how we came about. And we obviously started to see pretty quickly on that there was these loopholes, and I know a lot of the previous presenters talked about this, exemptions, right? So we have zoning, we have home rule, we have all of these systems that were in place to protect us. And the oil and gas industry rewrote the rules. They got what they needed well before they started fully industrializing our urban and suburban and rural areas, so they could have carte blanche to be anywhere and everywhere. School, doesn't matter. Church, doesn't matter. Homes, no way that they're gonna stay away from homes. So, got a problem, pretty major problem. Just gonna say a few words about how I became involved and where I saw this happening in Pennsylvania. I actually was working on coal mining issues down in southwestern Pennsylvania. We were trying to grapple and understand when the shale gas development started happening. We thought, hey, people should have rights to protect their surface. And so we started developing, in my previous position, the Surface Owners Protection Act. And we quickly realized the deck was absolutely stacked against us. But the one thing, and I still firmly believe that this is a valid argument, was they couldn't answer the health questions, right? So I actually saw our previous governor, two previous governors stand up, say, this is great, it's good for the economy, it's good for the jobs, boom, everything's wonderful. People started asking him about health questions, and he was like, next question. So they didn't want to talk about health. And I do believe that, you know, as we value our health and as we work to improve our health, this issue is going to ultimately possibly resolve itself, I think, in the court of public opinion. But I'm going to hand it over to Jessa to start really unpacking again why we've created the tools we've created, what exactly is in our health exposure assessments and the toolkit.
In Pennsylvania, we do not have many public health departments. So Washington County, where we're located, we do not have one. I think there's only 3 to 5 in the entire state. So this has really become an issue that was primarily put on us as a nonprofit. A lot of clients started coming to us with health symptoms. So at the time we had a nurse practitioner and we really wanted to understand what was going on. A lot of our clients would come to us and say that their healthcare provider didn't know much about the issue or didn't really want to hear about it. Unfortunately, we had some clients come to us and say that their healthcare providers told them, if you bring this issue up again, we're going to have to ask you to leave this practice. We just don't want to hear it anymore. So we really became that group for people to come to talk to about their issues. Like Raina said, we don't have to meet any kind of quota or certain patients coming in. So sometimes when our clients come in, meeting with them can last about 2 hours, which is quite a long time. But we go through an individual health exposure with them, which was adapted from the American College of Medical Toxicology and the Agency for Toxic Substances and Disease Registry. And this individual health exposure, you know, goes through your normal things that you would at your doctor's office, family history, possible exposure history. But what we also do is a home exposure history. And that really looks at what activity is near you. Have there been accidents, spills? How close are you to this type of infrastructure? You might not have infrastructure near you, but you might be a service road where you're having dozens or even hundreds of diesel trucks going by your home every day. We ask people about their water, where we're located in a lot of the counties we work with. A lot of people are on well water, and we'll get into that a little bit more later. And we ask them if they've seen changes in the color of the water, the taste, same with air. Are they smelling any unusual odors? When is this happening? How often? And what we do with these forms, although they can be quite time intensive, we actually pair this with air and water monitoring that we offer to our clients. And all of our services in Southwest Pennsylvania are free to the community. So what we do is we take this individual and home exposure and also pair it with air and water monitoring that we're doing simultaneously with our clients to see what's going on and to see if this is the cause or if there is another environmental concern. So this is a graphic that we recently created. A lot of the time we get a lot of questions. I mean, this is a complex issue. I've been with EHP 5 years, and every day I'm learning something new. But a lot of people ask us, how does shale gas development affect public health, and what are the risks? And we found that there are multiple risks. As you can see, starting from the left-hand side, the issues, just even the process of fracking, from disrupting your natural environment, the land, the water. It also produces large amounts of solid and liquid waste. And then with those kind of issues are the health concerns that are coming through this. What are the potential health concerns that we're seeing? And then also the issue of inequality, a lot of issues with environmental justice. And in Pennsylvania, we're seeing a lot of issues now with eminent domain and to bring in pipelines throughout Pennsylvania. Again, what's different kind of about shale gas development is there's multiple pathways of exposure that we're seeing with our clients. So that can be air, water, and soil, and it can be through particulate matter, so PM, VOCs, your volatile organic compounds, heavy metals, and even, again, the liquid and solid waste. Again, it's an issue where you're also having, our clients are having multiple pathways of exposure. So inhaling it, ingesting it, coming into contact with it. Another thing, who is impacted by it? And what we like to point out, it's not just one individual person or even community, but it's really affecting a lot of people. One number I wanted to read you guys, as of I think a year or so ago, Environmental Health Perspectives had estimated that 17.6 million Americans live within 1 mile of an active oil and gas well. 12.6 million of those are within a half a mile, and they're within 1.3 million facilities. And to go a little more, 2.9 million children go to school within a half a mile of oil and gas. So we really like to let people know that this isn't just, you're one person in the community saying this, one individual, or just maybe one community. It's really affecting a lot of people. And another issue with this is why there's so many multiple risks is the magnitude of exposure. How long are you being exposed to this? Are you being exposed to it at home, at work? Are your children being exposed to it at school and at home? How toxic is this? How close are you to a source? How many sources are around you? And what stage of production are these sources in? In Southwest Pennsylvania, we have a lot of clients that'll come to us. In a half a mile of them, they'll have 15 wells, 2 compressor stations, and a pipeline coming through. So with all of this, the aggregate emissions we're seeing are really causing issues. Of course, there's also the vulnerability of individuals, elderly, children, women that are pregnant, and then also those that are working in this field. The short-term health effects, I'm sure you guys have heard a lot about and people have mentioned today, so I won't go through them. Stress is a big one, which Stephanie talked about, and I will also talk about a little bit. Skin irritation, headache, dizziness, a lot of asthma attacks. We're seeing COPD, and then also the issue of adverse effects on developing fetuses. And then, of course, the long-term effects, chronic bronchitis, asthma, different types of cancer, nasal, throat, lung. But we thought this was a good visual way to kind of explain, or hopefully explain, what is a complex process. I won't go over it too much because I know Stephanie talked about it, but one thing, we've seen hundreds and hundreds of clients at our office, and the number one impact that we're hearing from our clients is just the stress of it, which makes sense. I mean, going from these calm rural areas to what is now almost an industrial playground, we're seeing a lot of health issues around that. People, are feeling isolated, neighbors that used to be friends, or if they don't lease their land, their neighbors won't get the money. So a lot of fighting internally. Lack of resources for survival, where you have a lot of people who have had to leave their homes because of air or even water, who are on water buffaloes, and some who even loss of employment or savings have tried to fight this, and with that have kind of gone bankrupt from this. So just the stress of all of this, the anxiety, not knowing if there are health concerns or what the future health concerns will be. And I just wanted to point out, again, we hear it a lot, and sometimes people say, oh, that's anecdotal, but there has been a lot of research around that, which is available on our website. So I wanted you to know that we're seeing it, but that a lot of other researchers in other places around the country are seeing this issue, and it's an issue that should not be ignored. Okay, so I was going to get into the Environmental Health Medical Toolkit. Raina, would you like to be my Vanna White and help me? So as Raina talked about, our mission is not only to educate residents, but also to educate you, healthcare providers, who are seeing patients that are coming to their office that might be having health concerns. So our toolkit is made up of 5 sections. The first one is the Environmental Health Medical Toolkit, just an overview. The second is the potential health effects due to inhalation, a reference for diagnostic coding, a proposed case definition, and a survey that can be used in your office. So the first one is our Environmental Health Medical Toolkit overview. And this really kind of is just to educate healthcare providers, kind of talking about the health issues that we're seeing, stages of infrastructure, the different types of air emissions and water contamination, and possible screening questions. And what we do in that is we also include an exposure history form, which was adopted from ATSDR. And really this first handout is really just for healthcare providers who have kind of no idea really about this topic. So we created just this basic thing kind of to first educate them on being able to kind of identify concerns and possible exposure hazards, possible exposures when it comes to organs, and the susceptibility of different populations. The next one is our handy dandy potential health effects due to inhalation. So this actually, it's a great form that shows you, I'll pull one up, gives, from what we know, from information that we've collected from the EPA and ATSDR, this is a chart that includes most common chemicals found in this type of industry, the sources they're coming from, and the short-term and long-term exposures. So diesel exhaust, like I was saying, a lot of times our clients, each day, hundreds or even thousands of trucks go by. And with diesel exhaust, that contains VOCs and PM 2.5. So a lot of the things we're seeing are eye, nose, throat, and lung irritation, and worsening respiratory disease. And this chart is just kind of a quick, easy way to see what are some of the main chemicals that are associated with this industry and what short-term and long-term effects can be, and also where they're coming from, if they're coming from well pads, compressor stations, and processing facilities. The next thing in our medical toolkit is a case definition, which includes, I guess typically with case definitions, you have an objective and also kind of a laboratory piece with clinical signs to decide if something is a case. So we, for shale gas development, came up with 3 types of cases that a resident could have, which would be either a confirmed case, a probable case, or a suspected case. For confirmed cases, that typically is that we know that they have air and water exposure, and this is from a laboratory or some kind of testing, if that's through us with our air and water monitoring, or they've had a professional come out. And then they're also exhibiting a lot of the symptoms that we typically see with those around shale gas development. We would think that they were a confirmed case. Then the second level is a probable case. This is when someone is around this type of industry, typically for about 20 hours a week for a month, and they're between a half a mile from this, and they are seeing symptoms. And then the suspected case is they're around this type of industry, but they're a lot further away. And this is kind of what we use when we go through our data to see what we're seeing with our clients. Are we sure it's because of shale gas development, or is it because they have maybe some pre-existing conditions? So when we're going through charts and everything, this kind of helps us dive through and see what we're really seeing with our clients. And it's a good way for you to kind of see if it's possible that your clients could be having issues related to shale gas development. Another thing in our toolkit is diagnostic coding. Currently, there is nothing at this time designated to shale gas development. So when you're doing ICD-10, you're putting this all into the system, you will find nothing related to oil and gas or anything. But what we found were a few. Our nurse educator spent a lot of time working on this, and we found some codes that we think would be applicable to this, specifically like noise. That's a big issue when clients are constantly talking about just noise 24/7. So these are just to kind of help you possibly attribute what you're seeing with your clients to shale gas development. And lastly is a survey for patients that we came up with that could be in your waiting room for clients while you're waiting to see them. It's just 5 simple questions. It asks people if anything has changed in their environment. Has there been a change in air or water quality? And what kind of health impacts are they having? And it's a good kind of screening tool. I know seeing patients, there's not a lot of time, so it could be something that's done in the waiting room. And it's a way to really kind of understand your patient's zip code and knowing where they're coming from and if there are issues. So all of this, we have some toolkits with us if you were interested, but we do have a section on our website dedicated just to healthcare providers. We have this under the Medical Toolbox. This also, if you read through the information and take a short quiz, it's worth 1 CME CEU if that's of interest to you. We also have information on biomonitoring on our website, which you've heard a little bit about earlier. All the client forms we talked about, what we do, what our nurse does with our clients. Other health advocacy groups that are interested in this, such as PSR, and frequently asked questions that we get from some healthcare providers and those answers. So we have a lot on our website for healthcare providers. We could have talked about it all day if we had time. But the other thing I was going to go into, if you can see these kind of buttons on here, we have, I'm going to talk a little bit about our health effects registry, and then a little bit later, Raina will get into one of our newest tools, the health impact assessment. Currently, there is not a national registry for oil and gas. The government, that's not on their forefront, and it was, not going to happen with what's going on. So EHP, through another group that we work with, they donated a platform for us to actually start our own national shale gas and oil health registry. So we believe this is very important for documenting and understanding the long-term health effects of shale gas development. So we launched this so we could kind of better understand the health effects, also recognize the size and scope of the problem, which I kind of told you earlier with, I think, 17 million in 1 mile. We'd like to understand more of that. I mean, we're seeing a lot of what's going on in Washington County and Southwest Pennsylvania, but we'd like to understand it more at a national scope. And with our health registry, we can also provide ongoing information and research that comes out. So at the national scope, no one else is doing this. I believe here in Colorado, I know in Pennsylvania and Ohio, there's quite limited health registries, but ours is now a national health registry, so anyone can sign up for it. Just a quick, to show you how simple and easy it is, here's an example of like one of the first questions you'll see on our registry, just kind of asking people what they're surrounded by. You know, there's multiple things. Sometimes people aren't sure where they're near, but well pads, metering stations, it's quite comprehensive. And then when we go more into the health effects, we ask people if these are new or worsening symptoms. And for this person, they had mentioned wheezing. So then it breaks down a little bit more, how often does this occur? And we also want to find out, has this been new since the development started, or is this a pre-existing condition? And again, that helps us kind of weed out to see what we're starting to see with people's effects. What's nice about our health registry is you can also see, based on what other people have answered, who's also having the same kind of issues that you are. Just some quick results. As of October 2018, we had over about 100 people in the registry, which isn't a lot in comparison to how many millions are affected by this, but we're hoping you, as healthcare providers, this is something that you can tell your clients about. But what we're finding is 53% of our clients that use private well water, and they live within a quarter of a mile of some type of infrastructure. And again, with those, we're seeing anxiety, stress, fatigue, painful joints, frequent sinus problems, sleep disturbance. So our registry is showing us, again, what we're seeing in Southwest Pennsylvania, but we're seeing the same results that researchers are seeing all over the country. And I should also mention our registry has, I think, 10 or 12 different states where people have registered from. So it's slow, but it's picking up. And I wanted to also mention that half of the reported people that are using well water are having dermal conditions because of it. So we're really thinking, we really see that well water, having these wells, compressor stations around people's water source is having an impact on them. So again, this is just kind of to, we hope that you guys will kind of share this information about the health registry. We know there's a lot of people out there, and we want to make sure that they're counted. By having people sign up for the registry, it can kind of help us push forward maybe in the future some legislation around setbacks or even how this industry is done.
So I'm going to talk a little bit more about some of the new things we're doing. And I just want to add on to what Jessa just said, that so much of what EHP does is exploratory. So we don't have all the answers. We're trying to figure them out. And so when you look at some of our forms and you even look at the registry, within the context of, again, there's a lot of trust issues, I think that's likely due in part, or is a factor in the fact that there's not a lot of participation, or certainly not as much as we had hoped. people need to trust the agencies. They need to trust who's acquiring their information. I'm going to talk a little bit about the setback distance handout and some of our general principles overall, which is that we're trying to make things that are user-friendly. We're trying to make things that people can understand, use, translate into the knowledge that they need for their local situation. I thought our first presentation was amazing because that's gold. That kind of data of a specific situation is so, so, so valuable. And obviously, she's a scientist. Not everybody has that capacity. So one of the things that we're doing, sorry, I'm getting ahead of myself a little bit, health impact assessment, I'll get to that next. Colorado, of course, you all know, has been struggling with this issue. We are struggling with it as well in Pennsylvania. EHP did an article, and this is kind of a funny story, we did a publication, a peer-reviewed publication on what we call our Delphi analysis. And the Delphi analysis, some of you may be familiar with it, is just really a polling of experts out in the field on a specific question and a specific series of questions. It's a very scientifically validated process. So we went through this process, we found the experts we could. I think we had about 18 to 20 experts that we worked with on this Delphi analysis, and then we wrote all the results up, submitted it for publication, and we couldn't get it published because there was no peer-reviewed experts to review it for us because we'd found all the experts who were available on the topic, which we thought was ironic. We finally did get it published, and what we have found, and again, this is very exploratory, but we're certainly looking at the health effects within that half-mile to a mile radius. And so we're doing our best to say, and certainly work with the community frontline groups, here's what you need to argue for, and here is the scientific validation for that argument. So that is a lot of what EHP tries to be. We try to be the source for the trusted, peer-reviewed, vetted knowledge, and also the frontline impacts that we're seeing to translate to policy. So it can't be our mission and our entire purpose to fight as hard as I know the community members can fight, but we want to provide you with the resources you need to fight for your health and your protection. So this is where we came up with this setback distance. You can see a similar photo in Pennsylvania as what you've seen in Colorado. Children playing on the school grounds. And you know, I said this 5 or 6 years ago, I'll say it again today. I do not think there's any doubt that there are health impacts from that type of proximity. That type of industrial activity, close to our schools, close to the children's playgrounds, I'm guessing almost all of you here know the respiratory rates, the childhood exposures, you know, this is not acceptable, right? So what can we do, and this is where we get into the policy and the political aspects of this, to say, you know, again, that's just simply not acceptable, and I think that the research is starting to prove that. So we, and as I said with the previous presentation, we're really trying to get people to understand what they're being exposed to or what they may be exposed to in their local community. And I'm sure that this is probably true in Colorado. I know it's true in Pennsylvania. If I want a policymaker in Washington County and a specific town in Washington County to listen to me, I have to tell him exactly what's happening in that town. So this, I think, is a really valuable tool for communities to start to speak, hopefully, to the people in power, their policymakers, and say, you know, do you know the answers to these questions? Because a lot of times, maybe they don't. And this is our newest thing, brand new, last week. And this, I'm so proud of my team and this document. What we can do now, based on our 7+ years of experience, is really isolate the emissions figure out the type of exposures that people are having, and really pinpoint what the exposure levels and health effects may be at this specific level. So what we're trying to do next is make this a template that's readily available for other communities. And that just in a nutshell is really what EHP stands for and what we try to do. We did want to leave plenty of room for questions, time. We've got good, at least 15 minutes, so I'd love to just open it up for questions. Perfect. Okay, so first question, has your toolkit been well received and utilized by the medical community? And do you encourage providers to do further testing, like chest x-rays, CBC, or referrals? I'm going to pass this on. Yeah. Does this microphone work?
Hello? Yep.
Yes, okay.
So the toolkit has been, it's been a growing effort. Washington County, where we're located, it's, I think it's quite jaded now. We've had a lot of this infrastructure there for a while. We're seeing that the toolkit, though, in other communities, other counties, other states, is being well received. So as of now, we've been working with a lot of nurses at Penn State, Fayette campus near us, kind of working that way with people coming into the profession. So we've done that. We've also kind of started working with a lot of social workers and psychologists too in the area to really try to understand this. Do you encourage providers to do further testing? This is a tough question. For us,
further testing question.
The further testing, yeah. So in Pennsylvania, where we're located, we only have one department that actually covers the tri-state area, Pennsylvania, Ohio, and West Virginia, that will do any type of kind of toxicology testing. And they don't only focus on shale gas development, they focus on everything. So getting an appointment there, most of our clients wait months and months and months. We've tried to work with other kind of local groups or local, like Quest Diagnostics, other places, and a lot of places in our area will not do this. So we really push to just have a lot of our clients just do kind of continual testing, like when they go to their doctor, having their organs, checked, all that kind of stuff. But for referrals, it's very hard in our area to have anyone do any further testing.
I don't need that. Okay, so the next question was, is there a representative from the Colorado Department of Public Health to answer what they are doing to inform and engage the medical community and to inform impacted communities about their oil and gas response program? So EHP, obviously we're in Pennsylvania, but EHP convened a national meeting with various health departments from across the country on this issue. We have been working with Mike Van Dyke from the Colorado Department of Public Health. I will say this, I know the woman who does this for the Pennsylvania Department of Health. She is just a contractual position. She has little to no freedom to speak to people, to advertise, to do it, and yet they say we have a robust public health registry and it's absolutely, completely user-friendly. Colorado's doing better than Pennsylvania. And yet it's not enough. I understand, and the scope of the problem certainly does, I would say, overwhelm the resources as well as the political will. And this has something to do, I'm sure, with the administration's. Pennsylvania's current governor really does embrace the oil and gas industry. So, we're fighting a battle, and sometimes the cards are really stacked against us. But I would say of the public health departments that I've talked to who really are looking into this issue, including New York, including Maryland, both of which have passed moratoriums, You know, I believe Colorado is really trying to do more, and, you know, maybe as much as politically possible at least, but they are joining the conversation, which is just not happening in Pennsylvania to the extent it needs to. And it's the antithesis is happening in Ohio and West Virginia. So even in Pennsylvania, if you, for instance, call the Department of Environmental Protection, you get lost in this sort of endless feedback loop between the Department of Health and the Department of Environmental Protection, and they constantly say, that's not our job, you're going to have to talk to that agency. Then the other agency says, not our job, go to the DEP. The DEP says, yeah, we're talking to the DOH, but we're not really prepared to tell you what we're saying. So it's a difficult scenario. So I think these two questions were related, so I'll read them both. What methods do you trust to collect robust air quality data? Why do these stand out? Why do you trust them? And then, is there any gold standard measurements, environment and or patient, that would help clinicians? So the other thing that EHP does a lot is we work with researchers across the country who are doing cutting edge research or who are not yet published. We've had some good luck working with Brian Schwartz out of Johns Hopkins and a handful of other researchers, some of whom are homegrown to you here, and I'm excited to hear from them later today. It's an evolving field of understanding. In terms of the air quality measurements, I know that Detlev is going to talk about some of the new, hopefully, things there. And we're constantly working in our area with Carnegie Mellon University. Carnegie Mellon University created a low-cost air monitoring device. We built an entire outreach program around that device. And then they somewhat turned their back on that device and started developing new devices. So we had an entire program for really this surrogate device because it's not measuring the VOCs. And we know that the VOCs are a key component. So we've created a whole system which we've been calling our Citizen Science Toolkit for reasons of immigration and other aspects. We're probably going to rename that and redo that as the Community Science Toolkit soon. But that was a way for us to create a comprehensive and affordable, because that was really important to us, that it was low cost, that it was something accessible. It's SUMA canisters, which are going to capture your VOCs. It's a grab sample. It's not perfect, but it's affordable. We're going to do the aldehyde badges, because we do see a lot of problems with aldehydes and the health effects that we're seeing. And then we do these continuous particulate matter monitors to give us a 24/7, 32-day monitoring. It's been vetted. You know, the SUMA canisters are actually a standardized, accredited lab analysis, but we're constantly trying to explore and tweak this system to get a better sense of how these monitoring devices are really working for the community. And because of some of the problems we've had with the current device we were using, we're probably going to start using more of the purple air, which we think is a good, viable substitute for that. And the gold standard measurements, do you have any thoughts on that? I mean, I absolutely, please use the toolkit. But don't just use the toolkit, come back to EHP and say, hey, I found this helpful, or no, I really needed something else. Because we're here to work with you as healthcare providers with your frontline community knowledge to improve upon our materials. More questions?
We're not going to get to escape yet.
I don't, I'm here for the long haul. Thank you.
Question on this, and then the next one.
Okay. Okay, so again, air monitoring. What instrument? Okay, I'll just go through this one by one. So we have been using what's called the spec. It was created in conversation with us, and we were really excited when we heard about this initially. It does measure particle matter 2.5. And one of the things, and this is not something you're going to get from the purple air, but we've found it, we've field tested it, we love it, in the sense that it has a screen that's correlated to the air quality index, and it shows you visually what your air quality is approximately. So it's a visual tool for people to have in their households. Very simple, plug it in. Sometimes that's not simple enough, but people, you know, we work with them, we get it placed, and people can actually track what they see as their air quality index. You know, there's a lot of mobile devices, but one of the reasons why we were very keen on this is because in some of the rural communities we work in, and this is maybe why the purple air isn't the ultimate solution, they don't always have Wi-Fi. So they may not actually have internet access. So the monitor that we use, the particulate matter monitor, is a very powerful visual cue for people who use it almost like a temperature gauge or like a pollution gauge for the day. So for instance, we had one woman who had a daycare over in West Virginia, and she said, I used that to tell me whether or not it was safe to have the kids play outside that day. So ultimately, you know, what we do is very public health oriented. It's very much oriented towards empowering people in the moment to make the decisions to protect their health in the absence of the regulatory agencies doing what they should be doing. And the screen, the visual aspect of the device that we were using, I think is one of the most powerful elements to it. So that is part of the reason why we like that. How long for air monitoring? We do 32 days because that gives us variable weather conditions, but we often repeat it in different seasons. We generally don't do air monitoring in the winter time. We try and do it in the spring, summer, and fall to account for different seasonal variations.
I would also add that if our clients know infrastructure, if infrastructure is coming, we do provide monitors to clients ahead of time so that they can actually get a baseline and kind of follow the whole process through. So testing before, testing during, and then testing when the development has stopped or they take down the rig or whatever. So we try to make it as comprehensive as possible.
Right, and because of approximately 600 air monitoring data sets that we have started to isolate out the contaminants that occurred during the different stages of each process. So for instance, we're seeing more concerns and more health symptoms with the actual fracking part. That's one of the highest emission periods within the whole life cycle of a well. So this is the kind of data that we're trying to get out there. I think I covered what is measured, and are the results accepted by officials? You know, and this is the same problem that the first speaker commented on with the lab analysis, and why EHP really struggles with advising clinicians to do biomonitoring, because it is a bit of a crapshoot. And people come to us and they say, that's not legal, that's not going to hold up in a court of law. And EHP is trying to do this to empower the individual residents to make health protective decisions in their own life. The larger beast in the room is that legal aspect to this and the population aspect to this. And at this stage in the game, it's a little beyond our capacity to tackle that.
This is a question of the cost of air monitors.
Okay. All right, so easy one. What is the cost of our air monitors? So our entire system, we have been using, as I said, this Carnegie Mellon device, which cost approximately $200. It's a little under $200. But we were providing that for free locally because we had worked out a partnership with the Create Lab, as they're called. The Summa canister is $250 for placement of the Summa canister, and this is measuring your VOCs, and the analysis, right? So you get the lab results, you do the Summa canister, it's a grab sample, as I said. The aldehyde badges are approximately $90 per badge. But we are doing multiple placements of these. So what we are trying to do now in our citizen or community science projects, which we've done in multiple places in Pennsylvania, we've done it in Texas, New Mexico. We've done it everywhere now. We've done it Virginia, New Mexico, various communities in New York State. And you know, we're trying to create a comprehensive community-wide picture of the air and the health impacts together. We haven't done as much with water because that's a little more difficult, but we've, I think, really created and refined, especially around compressor stations, probably some of the best knowledge in the country about how to do a comprehensive air monitoring system. So that's it. Yeah. Thank you.
Thank you both very much.